Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, if you haven't, go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. It's a great study guide or a great refresher if you're out in practice. So I know a lot of pharmacology students have taken advantage of that free resource. So go check that out. Simply an email will get you access to that at reallifepharmacology.com. All right, let's get into the drug of the day today, and that is Diclofenac. Brand name of this medication is Voltaren, and I'm going to primarily focus on oral administration of Diclofenac for this episode. So keep in mind the absorption from using the topical agent is much, much less than using the oral agent, obviously. So some of the side effects that show up at higher risk for oral systemic administration may not be quite as true if we're giving the topical agent there. But so when I'm discussing this, I just wanted to lay that out and say, hey, I'm reviewing oral and systemic adverse effects with this medication in this episode, and I'll potentially do diclofenac gel in a future episode. All right, so this medication is an analgesic. It's an NSAID, and mechanistically how NSAIDs work is they inhibit COX-1 and COX-2 enzymes and ultimately reduce prostaglandin synthesis. Now, there's a few different prostaglandins, and they're responsible for a variety of things, but how they work in pain relief and inflammation and fever, that's an important aspect to remember with diclofenac and why we would potentially use this medication. So again, prostaglandins are kind of mediators, and they're responsible for inflammation, pain, and fever. And with diclofenac, we reduce those prostaglandins and ultimately can help alleviate inflammation, pain, and fever. So what conditions is this medication used for? Obviously, any type of acute pain, it can be beneficial for that. I have historically seen it in situations where there's generally much more inflammation because NSAIDs can help with that significantly. So rheumatoid arthritis is probably the most common situation I've seen diclofenac used for. Can be used in gout management, osteoarthritis, migraine, and then obviously any generalized acute pain as well. Dosing and dosage forms, the immediate release formulation is dosed typically 2 to maybe up to 3 or 4 times per day. I've seen in practice most often twice a day or 3 times a day. The immediate release dosage forms, 25, 50, and 75 milligrams are the most common. Usual daily dose, 100 to maybe up to 150 milligrams per day in those divided doses there. So, and the reason why immediate release needs to be dosed so frequently is because it's got a shorter half-life of just 2 hours. The extended release product can get away with a little bit longer interval and obviously less frequent dosing there. All right, let's get into adverse effects. So first and foremost, I wanted to start with boxed warnings, and both of these boxed warnings are class-related, so NSAID-related. So the first one involves increased risk of cardiovascular events, so MI, stroke, for example. And again, this is a class boxed warning. And the other one is GI bleed. And in addition to that GI bleed risk and having a boxed warning, it also shows up on the Beers criteria, which is medications that are potentially inappropriate for elderly patients. Now, I do want to dig a little bit deeper here. So recall that NSAIDs have varying degrees of cardiovascular risks and GI bleed risks. So where does diclofenac kind of fall in line with all the other NSAIDs? So one big downside to diclofenac is it is significantly high risk on the cardiovascular risk side effects. So that's a challenge. If you've got anybody with ASCVD or risk of heart attack, stroke, things of that nature, diclofenac is probably one you're going to want to steer clear of. And if you recall, of the NSAIDs, naproxen tends to be the lowest risk when it comes to cardiovascular risks there. And if you want to go to MedEd 101, simply Google search NSAID comparison table at meded101.com, and you can kind of find a lot of these different NSAIDs laid out and the risks and how risky they are in cardiovascular risk, and then I also lay out GI bleed risk as well. So diclofenac, as far as GI bleed risk goes, is fairly high. I wouldn't call it the highest. You'd probably call ketorolac or something like that the highest risk GI bleed NSAID, but diclofenac definitely is significant there. Typically with the COX-2 inhibitor celecoxib being the lowest GI bleed risk, kind of in that NSAID scale and categorization. Other adverse effects to think about with diclofenac, so edema, fluid sodium retention can definitely happen with diclofenac, so that is especially problematic in anyone who's already fluid overload. So CHF probably being the most common example. And then, you can have situations like cirrhosis with ascites, for example, where edema could be worsened by diclofenac. GI upset, kind of alluded to that with the GI bleed, but it's important to recognize I've seen numerous examples of the prescribing cascade with NSAIDs like diclofenac, where they get started on diclofenac, and then they ultimately, 2 weeks later, they get started on a PPI or a GI type medication to reduce symptoms of GI issues. Well, those symptoms could definitely be caused by a drug by diclofenac. So really pay attention to that for sure there. So in addition to kind of heartburn, obviously GI bleed, ulceration, things of that nature, administration-wise to reduce that GI upset, generally recommend to give with food or milk. Other adverse effects, increase in blood pressure, usually not crazy significant, but I think it definitely is something to remember in patients that are particularly non-responsive to blood pressure lowering medications, or if their blood pressure is significantly too high. Can increase bleed risk on its own, even in addition to GI bleed risk. So pay attention to bruising, bleeding, things of that nature. And then, of course, NSAIDs like diclofenac can impair renal function as well. So when we talk about monitoring parameters, obviously, bleeding, bruising, we're going to look at CBC, hemoglobin, platelets may be important there. Renal panel, of course, looking at creatinine, monitoring that kidney function is going to be critical there. There have been some rare increases in LFTs, so you may see that recommended periodically, or if there's clinically significant concern with that. Generally not something I'm too highly concerned about, but it's way in the back of my head as far as risks associated with NSAIDs. All right, I'm going to take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCM, TMS, NAPLEX, or others, go check out meded101.com/store, S-T-O-R-E. We've got a great list of resources that have helped thousands of pharmacists pass their board exams. So great way to support this podcast is to support meded101.com/store. In addition, if you're a nurse practitioner, PA, med student, nursing student, tons of other resources available, books from Amazon, all those links help support the podcast. So again, go check out all those resources at meded101.com/store. All right, wrapping up with drug interactions. There are definitely plenty with NSAIDs. A lot of them have to do with additive effects versus CYP interactions, so definitely cover a lot of them. So if you can recognize some of the adverse effects, you're probably going to recognize some of these drug interactions. So first and foremost, I think about bleed risk. That's definitely something you have to pay attention to. Patients on anticoagulants like apixaban, for example, warfarin, patients on antiplatelet agents, clopidogrel, aspirin therapy. Adding diclofenac on top of that will increase bleeding risks, and probably most specifically will increase the risk for GI bleed. Really, really important to pay attention to that one. Renal impairment, adding on other drugs that can worsen renal function. So loop diuretics, for example, ACE inhibitors, ARBs, thiazide diuretics. Definitely lots of medications that can impact renal function that could exacerbate the risk for renal impairment and acute renal failure. So definitely remember that with diclofenac and NSAIDs in general. Elevations in blood pressure. These diclofenac can go to directly oppose some of the blood pressure lowering meds that we're maybe trying to use to manage hypertension. And then it can definitely oppose diuretic action. We often add furosemide, a loop diuretic, to manage edema and swelling. Keep in mind, diclofenac can do just the opposite and try to make that edema worse, basically, and oppose the beneficial effects that we're trying to have with a drug like furosemide. And then last but not least, there is some CYP interaction potential there. So CYP2C9 inhibitors can raise concentrations of diclofenac. CYP2C9 inducers can lower concentrations. Some examples that you might see as far as inhibitors go include fluconazole or voriconazole, CYP2C9 inducer. Rifampin's kind of a classic example that we always see mentioned in the literature there that could lower concentrations of diclofenac. All right, well, I think that's going to wrap up the episode for today. Do me a huge favor, leave a rating review on iTunes or wherever you're listening. I greatly appreciate that. It helps us grow the podcast. Share us with friends, colleagues, email listservs, anyone who may benefit from pharmacology education. We rely on your continued support to help share this podcast, and obviously I hope you benefit from it. If you feel like you could benefit from other drugs or other things that you feel I should cover, definitely don't hesitate to reach out, mededucation101@gmail.com, or you can track me down on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. Also, don't forget to support the sponsor, meded101.com/store. Tons of resources, tons of books. We've got fun stuff, crossword puzzles, all sorts of different books that will help you learn pharmacology better. So until next time, I hope you have a great rest of your day.